Have you ever been told your blood pressure is a little high and thought, it's probably nothing? You feel fine, right? No pain, no shortness of breath, no warning signs. But here's the truth. High blood pressure is often called the silent killer for a reason. It can quietly damage your body for years, until one day it's too late. Today, we're going to uncover what really happens inside your body when you have high blood pressure. Before we start, if you care about your health and want to understand your body better, make sure to subscribe and hit that bell icon. Let's keep learning together. Let's start from the beginning. Imagine your body as a giant city. Your heart is a central power station, pumping life through every street and alley. Your blood vessels are highways and side roads that carry oxygen and nutrients to every cell. Now, picture water flowing through a hose. When the pressure inside the hose is normal, the water flows smoothly. But if the pressure is too high, the hose starts to strain, stretch, and eventually crack. That's what high blood pressure does to your arteries. Blood pressure is simply the force of your blood pushing against your artery walls. It's measured in two numbers, systolic and diastolic. Think of it as the push when your heart beats and the rest between beats. When this force stays too high for too long, your heart, blood vessels, and organs all begin to feel the pressure, literally. Here's the sneaky part. You don't feel high blood pressure at first. No headache, no dizziness, no alarm bells. Let's meet Sarah, 48 years old. She works long hours, drinks a little too much coffee, and tells herself she's too busy to exercise. At her last checkup, her doctor said, "Your blood pressure is 145/92. She shrugged it off. What Sarah didn't realize was that every day her blood was hitting her arteries with extra force, like tiny waves slowly eroding a cliff. Inside her arteries, microscopic tears began to form. Fat and cholesterol started to stick to those damaged spots, forming plaques that narrowed her blood flow. Her heart had to pump harder to push blood through, creating a dangerous cycle. This is how hypertension silently ages your body from the inside out. Let's go deeper, organ by organ. Your heart is a muscle when it has to pump against constant pressure. It gets bigger and thicker, just like a bicep after lifting weights. But unlike a gym muscle, a thickened heart isn't a healthy one. It becomes stiff and less efficient. Over time, this leads to heart failure, where the heart can't keep up with the body's demands. High blood pressure is one of the top causes of stroke. Here's how. Imagine a weak spot in a balloon that's constantly being overinflated. That's what happens to the arteries in your brain, until one day it bursts, or a clot blocks blood flow, starving brain cells of oxygen. Result? A stroke that can change your life in seconds. The tiny blood vessels in your eyes are delicate. Constant pressure damages them, causing blurry vision or even blindness over time. Some people first discover their high blood pressure during an eye exam because the doctor can see the damage in the back of the eye. Your kidneys are natural filters. They clean your blood and regulate fluids. But when the arteries feeding them are narrowed by high pressure, they can't filter properly, leading to chronic kidney disease. It's like trying to clean a dirty pool with a clog filter. Eventually, it just fails. Every artery in your body starts to harden and stiffen. This is atherosclerosis, and it's why people with high blood pressure are at higher risk of heart attacks, strokes, and even dementia. Now let's get practical. What causes this pressure to rise in the first place? Here are the usual suspects. Too much salt makes your body hold on to water, increasing volume in your blood vessels. Stress releases hormones that tighten arteries. Lack of sleep messes with your body's ability to regulate pressure. Smoking and alcohol damage blood vessel walls. Poor diet and inactivity lead to weight gain, which makes the heart work harder. And yes, genetics play a role too, but lifestyle is the biggest piece of the puzzle. Here's the good news. High blood pressure is not a life sentence. Your body can heal more than you think if you give it the right support. Move your body daily. Even a 30-minute brisk walk helps open arteries and strengthen your heart. Cut back on salt and processed foods. Eat potassium-rich foods like bananas, spinach, and sweet potatoes. They help balance sodium levels. Sleep well. Your blood pressure naturally drops during rest. Don't rob yourself of that healing time. Manage stress, meditation, prayer, journaling. Anything that calms your nervous system helps your arteries too. Check your blood pressure regularly. Don't wait for symptoms, because there usually aren't any. Remember Sarah? After a small scare with chest pain, she made changes, started walking, lost weight, and reduced her salt intake. 6 months later, her blood pressure dropped to 120/78. Her energy came back, her anxiety went down, and she felt like herself again. So, what really happens to your body when you have high blood pressure? Your heart strains, your arteries harden, your organs suffer, all in silence. But it doesn't have to end that way. You have more control than you think, and every small habit matters. If you take one thing from this video, let it be this: your body whispers before it screams. Listen early and act sooner. If this video helped you understand your health better, please give a thumbs up, share it with someone you love, and subscribe for more science-based health insights every week. I'm Dr. Alex Carter. Take care of your heart, and I'll see you in the next video.